Welcome to the Diversity Connector podcast, where we explore the rich tapestry of human experiences. I'm your host, Gertrude Mache, and I'd like to acknowledge the traditional custodians of the country on which we meet today. I would also like to pay my respects to elders, past, present, and emerging, and together as we dive into conversations that bridge cultures, challenge stereotypes, and celebrate the unique perspectives each of us brings to the table. Each episode is a journey through stories and insights from a kaleidoscope of voices, each sharing their colorful narrative. Whether you're at home, on the go, or just anywhere in between, you're now part of a community that values understanding, inclusivity, and the beauty of diversity. So plug in your headphones, get comfortable, and let's connect through the power of our shared stories. Welcome, and thank you for joining us on the Diversity Connector podcast. Hello, everybody, and welcome back to the Diversity Connector podcast. This is Gertrude Mache here in beautiful Melbourne, Australia. And today I am graced with the presence of yet another fascinating woman. Welcome, welcome, welcome to our tribe. Please tell everybody your full name, where you're based, and share your story with us today.
Hello, everyone. Thank you so much for having me. My name is Dr. Akeyla Brown. I'm currently based out of New Jersey, Livingston, New Jersey in particular. I was born and raised on the East Coast. I'm originally from New York. I'm a practicing oral surgeon. I didn't always know what I wanted to be, and I actually hadn't seen much representation in my lifetime, or at least my early life. And then when I started doing an internship at Howard University, I was able to be introduced to a mentor, Dr. Andrea Bonnick. She's an incredible oral surgeon who was the acting program chair of the Howard University Hospital program, the residency program. And I was just fascinated by her, fascinated by all she had accomplished, how much she's touched so many people, and seeing how much passion, compassion, and power she had with every word, with every action, in every case. I just knew that I wanted a piece of that, and I wanted to see what my future would look like if I followed in her footsteps. And I then pursued dentistry. I was able to attend Howard University College of Dentistry. I enjoyed so much that diverse experience with so many people of color. It was just really enjoyable for me. I felt like I learned so much in such a safe space that I wanted to continue in that environment. And I matched at Howard University Hospital's oral surgery residency program. After completing the program in 2018, I then moved to New Jersey, where I've been practicing for 6 years. I also had the opportunity as working as an attending with NYU Langone at an AEGD program in Jersey City, where I'm able to give back some of my time. And that's my story.
Now, you have had a fascinating journey in a field that is mostly male dominated, but a field that has very few women of color.
Mm-hmm.
Now, you managed to find yourself a role model, somebody who became your mentor. How important is it for people of color to have somebody who leads the way, who shows them how? How did that impact on your career?
Oh, I think it's huge. I think we forget how huge it is because who serves as representation, it seems so monochromatic, and we don't realize that a lot of the successes that other people may have from different backgrounds is probably because they were able to see someone who was doing something that they dreamt of doing. So I know for a fact that having representation matters. You follow in your family, your tribe's footsteps. That's just what you do. Once you know that something's accessible and possible, you feel that possibility within yourself. You no longer think that your race or your creed or your sex is a barrier or limitation to achieving certain goals, and it just opens the world to you. So I definitely think that having representation is crucial. It was crucial for me. I didn't even see being an oral surgeon as a possibility, and that's why DEI is so important to me, because that equity part, making it possible for everyone to achieve goals, making it plausible and making it foreseeable is just such a huge deal.
Now, what challenges did you face, and how did your identity and background shape your path along the way?
So I've faced many challenges. The greatest challenges were my own insecurities, beating that. And I think that's for everyone. Once you defeat that, you're unstoppable. Of course, I've had some of my colleagues and predecessors question or doubt my talent and my skill. And it was definitely because I was an African American female. But I just had to remember that that's their ignorance. And I had the support of my family who believe in me no matter what. They think I'm awesome and that there's nothing that I can't do. And returning to that great support system is what allowed me to go forward and to persevere and accomplish as much as I have.
I love that. And I think having family support is absolutely crucial for a young woman who is forging into a field where there's very, very few people like her. So, in the field of oral surgery, representation is crucial for aspiring future generations. Can you discuss the importance of diversity within your field and any changes you've observed over your career?
In medicine, there's always a need for diversity. The hugest need for diversity is to combat anchor bias. We tend to, as practitioners, see groups of people a certain way and forget that there's certain diagnoses that are associated with certain nationalities. Having that anchor bias can definitely be combated by the introduction of diversity into the field, a new perspective, a clean perspective per se, that can shake things up and allow for better patient care, patient management, and treatment. I think it's also comforting for a patient to see someone that looks like them, or even to see someone who they know is diverse and may have a diverse perspective on their care. I think that allows for just better medicine overall.
Now, how do you advocate for more inclusivity and diversity within your workplace at Riverside Oral Surgery? Are there specific initiatives or programs you've implemented or participated in?
So, our community outreach is huge, and that's something that we already had, but definitely with my participation, we're propelling that and finding different avenues to reach into the communities that we're moving into. Something else is mentorship to uh, dentists, practicing dentists, or recent graduates, dental students, uh, undergrad students who are interested in the field of dentistry to come and mentor and shadow in our practices. That's something that we're working on as well. And then, we've just started translation services, which I think is huge, letting patients know no matter what language they speak that they're welcome and that there'll be a mechanism by which they can express all of their concerns. And that when they're signing consents, they know what they're reading and they can feel comfortable that they're being treated fairly and appropriately. And then some things that we're also doing is acknowledging, gender on forms, pronouns on forms. I think that's really important that we understand the pulse of our patients and the pulse of the times and what people are going through and what makes people feel heard and what allows for an equitable environment. And I think that we're definitely making initiatives to continue to do that and to be cognizant of that.
Now, I just want to go back to mentorship roles. Mentorship is often a key factor in the success of underrepresented individuals in specialized fields. How have the opportunity to, sorry, have you had the opportunity to mentor others? And if so, how do you approach mentorship to foster diversity and inclusion?
Biggest thing I think is that I've maintained an open heart and a open spirit. I'm constantly available to anyone who reaches out. And then I do make myself accessible in different avenues. As an attending with a residency program, that puts you in a position to be a mentor in itself. I was lucky enough to have two Black female residents matriculate through my residency program or through the residency program. And it was really wonderful to build great relationships with them that I've maintained throughout their careers. They always have access to me to ask me about personal matters, to ask me about negotiation of their contracts, which is so important, to ask me about clinical cases. Having that support, having that safe space, it's really, really crucial to navigating through your career. I do try and keep an open platform when it comes to LinkedIn or Instagram. Often during match, residents or those seeking to become residents reach out, ask for tips and tricks on how they should navigate that experience. Also, I'll have some people who graduate and they're picking what employer they're going to go work with, choosing where they're going to move to, what environment do they feel like is most profitable and also inclusive, where they feel like they'll be accepted by patient populations and employers that'll make it an easier transition for them. So I think that basically I try and stay open and be a safe place for people younger than me to come and, like, lay their shoulder on me, ask questions, use me as a resource. I think that's a big part of mentorship, and I think that's a part of mentorship that I've been successful at.
That's wonderful. They say that we stand on the shoulders of giants. You had your mentors whose shoulders you stood on, and now you're doing the same thing for young people coming up. So, throughout your career, have you encountered bias, and how have you navigated these situations? How do these experiences inform your work and advocacy for diversity now?
Oh yeah, I've definitely experienced bias
Mm,
from, at every level. I've had some assistants be biased against me, not in my current position, but in the past, I've experienced that where, we wear surgical caps and someone likened me to like Aunt Jemima. It was devastating. You work so hard and you come to work and you're like, this is not something that I'm going to hear, and it catches you off guard. um, Getting through that was hard, and it really, really did hurt. I definitely built a thicker skin. I don't think that if those words came across me again, that it would wreck me as much as it did. Um, but a platform like this allows me to discuss this issue, and then maybe more people will hear it, and then it doesn't have to happen to someone else. um, so that's a situation of bias. And then on a day-to-day basis, patients ask you, oh, you're so young, you look so young. And I
mm,
know that that doesn't just mean that I really look young. I think there's also a factor of you're also African American, and I wasn't expecting you to be a female. And that's okay. It is a lot of pressure because then you have to do the best so that you're representing for every Black female out there, that if this case goes wrong, then it's that all Black female doctors don't know what they're doing. But
mm,
I've been trained really well. I'm a confident practitioner, and I know that I can handle anything that I accept at my table.
yeah.
So I know that every time that I'm doing a case, in turn, I'm actually representing for all those women and all those women of color, making it possible to be respected and to be questioned less when these patients walk into a room.
How do you believe having a diverse team impacts patient care and outcomes in oral surgery? And can you share an example where diverse perspectives improved a patient's treatment or experience?
Yeah, so I think that when you have a diverse team, there is a diverse team that's equitable and respected. I think there is an opportunity for everyone to serve as an advocate for the patient.
Mhm.
So, in that way, if anyone's doing something wrong or making a mistake, anyone at any level can arbitrate for the patient and say, hold on 1 second. Is that the right patient ID? Are we doing
Yeah.
the right procedure for the patient? Is this what we're supposed to be doing? And everyone in the hierarchy should feel comfortable arbitrating for the patient. And I feel
Right.
like diverse environments foster that. If everyone's the same, and we're also friends outside of work, and we're drinking buddies outside of work, and there's
Mm,
this strict hierarchy where you have to look a certain way to be in that environment, there's a level of fear that's fostered there that does not allow for dissent. And in a clinical space, dissent is very, very important, because it's impossible for everyone in the room to constantly be doing the right thing 110% of the time. So
mhm.
I think that in that way, having a diverse environment, having diverse workers, staff, practitioners, allows for a safer environment for the patient.
Now, from your perspective, what are the biggest challenges the healthcare industry is facing, specifically for oral surgery, in becoming more diverse and inclusive?
I think in general, medicine, period, it's just, especially after COVID, it just doesn't have the selling factor that it used to. It's just, we're just not attracting as many practitioners as
Mhm.
we should. I think there's just a shortage altogether. The work is
Right.
hard. The work is draining. There's a lot of burnout. Um, and with the technological advances, with AI, with the academic advances, there's just a lot for us to know, and there's a lot of responsibility. And
Yeah.
enticing people to want to serve, despite all that, can be really, really difficult in a world where there's so many different avenues to make the same amount of money, if not more. But you don't, and what my predecessors, my mentors, my professors have always told me, you don't do this for the money.
Mm.
You do this because you're passionate about it. You do this because you're helping people. You do this because through this you sleep better at night and you're making a difference in the world. And I think that if we can somehow find a balance, I think that will definitely change our industry. I think if we are a more diverse group of people, I think that'll make it a more comfortable environment to work in. And I think that'll attract more diverse practitioners. And then I think making sure that the people that are practicing right now that aren't diverse, that they're more culturally competent and more relatable, that they're building safer environments to welcome this new generation of diverse oral surgeons.
Let's talk a little bit about cultural competency. It's a term that gets thrown around, but a lot of times people don't quite grasp what it means. Can you just expand on that a little bit?
Yeah, so for example, clinically, cultural competency, for example, let's say you have an Indian patient and they present with a lesion, an intraoral lesion in their mouth that you hadn't seen before. You ask the patient, "Do you use chewing tobacco?" And of course, they would say like, "No, I don't use chewing tobacco. Absolutely not." And then the conversation may end there. But someone who's culturally competent would understand that maybe there's some other mechanisms of or things that you're chewing on, like betel nut or betel quid, that you wouldn't know about unless you understood the culture. um Cultural competency and understanding hours of operation. Certain religious observances are going to take place at certain times. Certain practitioners can't work at those times. Some of their staff members can't work at those times. Building an environment that's understanding that we all are not just a blank slate. We come with responsibilities. We come with spiritual commitments. We come with how we were raised. We come with our culture, and that's a part of how we work through the world and how we interact with one another.
Mhm.
And being competent allows us to have respectful relationships and fruitful relationships with one another, um, that avoid a lot of angst and a lot of conflict. Um, and I think it's just super, super important that everyone, even myself, I have to be culturally competent. Just because
Yeah,
I'm a Black woman, just because I'm a woman of color, doesn't mean that things can't be lost on me. And I
yeah.
should be ever aggressive, trying to know what makes you different, what makes you unique, and how can I celebrate that.
Yeah.
and make you feel comfortable.
So, what advice would you give young individuals from underrepresented groups aspiring to enter the field of oral surgery or dentistry?
Never give up. Your Where you start from has nothing to do with where you're going to end.
Yes.
There's always someone out there who is willing to help you, to give you a hand. I'm available. You can definitely reach out to me. And in any way that I can, I'll try and be a resource.
Yeah.
And there's so many more people like me who want to help and want to see the growth of our industry. We respect it and love it and have great passion for it. And we know that new minds and new voices will only make it better. So we're eager for that. So if you ever need anything, please feel free to reach out for me. And not to get on my pedestal, whatever religion anyone practices, stay prayerful, have faith, believe that you can do anything. And if you just put in the work, it will happen. And it does. And I'm proof that it'll happen. I didn't come from a background that would say that I was going to be a doctor, but here I am.
Now, let's touch a little bit on racism.
Mm.
Race relations issues in the United States have come to the fore, with the George Floyd case. We all got to really see a side of America that was kind of hidden but always there. Let's start with systematic racism. How has it impacted you and your career for a start?
Well, only 3.8% of oral surgeons are Black. And it's been that way for a really, really long time. I'm not going to blame any one institution in particular. And I'm not going to say that there was a meeting held to say that there shouldn't be any Black oral surgeons. But there are systems in place that create obstacles that hinder people from getting certain places.
Yeah.
And that's just the foundation of our nation, unfortunately. And to deny that would just be silly. And that's why I think DEI is so important, because you're acknowledging that the playing field is not equal. The vantage point for everyone is not equal. And creating an even playing field, making something fair, does not take away from the legitimacy of that thing.
Yes.
If more people have access to learn to become great oral surgeons, that doesn't make oral surgery less illustrious or less of an intellectual industry. It just makes it a place where we have more minds working together. It's just bad business too. The level of systemic racism it's proven to just be bad business. And I think that all needs to change. George Floyd, that was like, as a Black woman raised in this country, that wasn't the first time that I had experienced seeing something like that. What was it? Amadou Diablo. And like, these were things that throughout my upbringing, I saw often.
Yeah.
It was just the first time that I saw it, and I didn't have something else to return to that day to distract me from the feeling that I was having at that time. And I think that's what was happening for everyone else. It was finally on our screen, and we were in COVID, and we couldn't go to work or hang out with our friends or go to a party to wash it away. We had to like live in it and deal with it. And I think we're still living it and dealing with it. And I think the people that really care and who felt genuinely uncomfortable are now making efforts to break down some of these systematic obstacles that are keeping people from great positions to do great work.
Yeah, it was an interesting experience. And I kind of feel like, because it has always been there, just under the surface of the society, a Band-Aid was taken off a septic sore. There's a lot of pus underneath the surface of America's society. And I think people just need to deal with it now and work on mending some of these injustices. It's been very, very interesting to observe from the outside. Now, because it's Black History Month, let's talk a little bit about internalized racism. A lot of times, as people of color, we lose our self confidence, our self worth, and we internalize a lot of the racism. You know, growing up as a little Black girl in Rhodesia, I grew up in an apartheid system
Mm.
under British colonial rule. And I remember hating my hair. Um, I used to chemically straighten my hair until I ended up growing it natural. What did you experience as a little Black girl growing up in the United States?
So I think I wanted a perm when I was like 7 because all my girlfriends had like straight hair. And I think I had a lot of hair. So like doing my hair annoyed my parents. So I think they permed it. But then I went to Howard and my my whole world changed. I mean, you're sitting in a dorm room with a bunch of girls, and the question isn't like, "Oh, what do you do with your hair?" It was, "Oh, do you want to try this new thing with your hair?" And we
Yeah,
would sit up all night. We'd study, and then we'd sit up all night and play in each other's hair, and we would like, get ready together and celebrate each other's uniqueness. And that was the first time in my life where I really saw how beautiful it was to be a Black woman, how amazing, how interesting, how fun, um, how normal it is.
yes.
I'm not other. I am. I'm the center of this universe. I'm my own main character. I'm not the Black friend who's playing along someone else's life. So it was an incredible experience. I wish I could give that to every Black woman, to be honest with you, because I don't think there's nothing like it. It made me love myself in all forms. Sometimes I walk around with my afro, sometimes I have braids, sometimes I press my hair. It just doesn't matter. But I know that those things, that also doesn't define me.
Yeah.
What defines me is my commitment to my people, um,
Mhm.
my commitment to change, my commitment to fighting for injustice,
Yeah.
my commitment to shining light on things that are wrong and searching to do things that are right, and my commitment to love myself, to love other Black people, to help other Black people, and to help anyone who's facing any kind of injustice. That's what makes me great. That's what makes me beautiful. That's what makes me who I am. And that's what makes me an asset to this universe. And you could strip everything else away,
Mhm.
but that's the crux of it. And as long as I have that, there's no reason for me not to feel confident. And there's no reason for me to judge who I am, because it was because I was raised by a Black woman. It was because I was raised by a Black man. It was because of all the things that I've gone through that have allowed me to see the world this way and allowed me to be this way. And I
Yeah.
wouldn't trade that for anything.
Oh, I love that. So, looking towards the future, what steps do you think are necessary to continue advancing diversity and inclusion within oral surgery? And are there any specific goals that you hope the industry achieves?
Yeah. So recruitment, recruitment, recruitment. I think that um, bigger companies like myself, like Max or any of these DSOs, I think they need to heavily recruit in diverse spaces. I think they need to heavily recruit at diverse institutions, offering great salaries, comparable salaries to these Black practitioners or practitioners of color.
Mm.
And then after recruitment, once you get a job, once you have yourself together, I think you have to reach back and mentorship, mentorship, mentorship at every chance that you can. And teaching, going back into academia, sharing the knowledge that you have to help us to become stronger so that this next generation is just even better practitioners. And outreach, constant community outreach, showing how important it is to have diverse practitioners so that the world can support it, so we can get buy-in from everyone. I think that's really the way to go.
Wonderful. So, my final question for you, Dr. Brown, is how has focusing on diversity within your professional and personal life enriched you? Are there moments or experiences that stand out as being particularly meaningful?
What has been so meaningful to me is not only have the people I'm working with accepted the role, they have celebrated the role, encouraged the role, and pushed me to do more. They're like, okay, what else can you come up with? What else can we do? What more can we do? Show us these dark corners that we don't know about. And I wasn't expecting that for them to be so accepting. And it's really nice to be around a different group of people who really just want to see me shine and want to see my efforts to make my people shine. So I'm just excited about that. That's been really heartwarming. I mean, you've been working, you know what it's like in the world. You know, sometimes you just don't feel accepted sometimes, and you don't even expect to find that at work.
Yeah.
I think you're like, that's the last place I'm gonna find that. But that I get to get up every day and go someplace that cheers me on and wants to see a world the same way I imagine the world is a really beautiful thing.
Oh, that is wonderful. It sounds like you've landed on your feet in the
I
right place
know.
at the right time.
Yes.
That's
Yes.
awesome.
Yes.
Dr. Brown, thank you so much for this interview. It's an absolute honor to have had you on the show.
Thank you for
Your,
having me. It's such a pleasure. I love the questions. It's been really awesome.
your experiences and insights are definitely of value to any person out there who's listening to this podcast. I created the podcast so that I can shine a light on different voices, different stories. So we celebrate our diversity as human beings. Diversity is a strength, not a weakness. So thank you for being here today.
Thank you so much for having me. It's such a pleasure.
And thank you to everybody who's tuned in today. The Diversity Connector is a platform that brings you stories and voices from people from all over the world, reflecting back our experiences. So tune in again tomorrow when I interview yet another amazing guest. In the meantime, have a fantastic day, morning, or evening, wherever you are in the world, and bye for now. Thanks again, Dr. Brown.
Thank you. Have a good night.
And that's a wrap, everybody, on today's episode of the Diversity Connector podcast. Thank you for tuning in and being part of our vibrant and global conversation. I'm your host, Gertrude Mache, and it's been an honor to share this space with you, where voices from all walks of life come together to weave a tapestry of diverse perspectives. Remember, every story you've heard today is a thread in the larger fabric of our shared humanity. So, as you step back into your world, carry these stories with you and let them inspire you to embrace and celebrate the rich diversity around us. Don't forget to subscribe, rate, and review our podcast to help us share these inspiring stories with more listeners. Do follow us on social media by looking for the Diversity Connector podcast for more updates. Until then, keep connecting, keep listening, and keep celebrating the beauty of diversity. This is the Diversity Connector podcast signing off. Stay curious, stay open, and definitely stay